Hello, teacher. We are going to present the historical event of the Black Death that was one of the most devastating pandemics in the human history. It occurs between 1347 and 1351, and it wiped out an estimated of 25 to 30 million people in Europe, about one third of the continent population. This disease likely originated in Central Asia, where the bacterium circulated among the wild rodents. It traveled westward along the Silk Road, reaching the Crimea, and it later entered to Europe through the Genoese trading ships that docked in Sicily in 1347. From there, it spread rapidly through Italy, France, England, Spain, and Germany, reaching as far as Scandinavia and Russia. And cities were overcrowded, poorly ventilated, and filled with rats. And those were the perfect conditions for the disease to thrive. The pandemic caused mass panic, like a massive panic, social collapse, and religious problems. There were entire villages disappeared with this sickness, and the economy nearly collapsed with all these things.
The infection involved Yersinia pestis. The culprit was the bacterium Yersinia pestis, discovered centuries later in 1894 by Alexander Yersin. It's a gram-negative coccobacillus that infects rodents and their fleas, and can jump to humans through bites. There are the main clinical forms of plague. Bubonic plague, the most common, causes swollen and painful lymph nodes called buboes in the neck, armpits, or groin. Septicemic plague occurs when the bacteria invade to the bloodstream, causing internal bleeding and skin necrosis, turning it black, hence the name Black Death. Pneumonic plague, the most deadly, affects the lungs and can spread through coughing, allowing person-to-person transmission. Main symptoms: sudden high fever and chills, headache and extreme fatigue, swollen dark bowels, vomiting and abdominal pain, delirium, and of death with the 5 days. The rapid course of terrain symptoms causes with the spread for hopeless.
How it spread during the 14th century, people had no knowledge about the germs or bacteria. Most of the people believed the plague was a punishment from God, a result from miasmas, and influenced by astrological alignments. However, today we know a lot of plague spreads and mainly throws, fleas during cocktail and inhalation, trade ships full of rats serving as vehicles for transmission across continents. Once of richer cities, it spread rapidly due to the poor hygiene, overcrowding, and lack of sanitation system.
Ways to prevent infection. Prevention was based on supporting and limited medical knowledge. People tried burning herbs or fires to purify the air, carrying flowers or being swap clothes. Quarantine chips, the origin of the term quarantine, 14 days. Religious rituals, flying cones, and pleasures. None of these methods stopped the epidemic, but quarantine actually helped reduce transmission in some parts like Venice, making it of early examples of public health intervention. The modern prevention today, thanks to scientific knowledge, plague outbreaks are rare or controlled. Control random population, amplify infections, use private clothing and infant repellents in risk areas, early diagnostics and antibiotic treatment, streptococc, doxycycline, gentamicin, prevent severe illness, insult infected patients, and monitor contacts and educate communities about sanitation and hygiene.
Now, talking about care and treatment, we have that medieval doctors wore iconic big masks filled with aromatic herbs, believing that it protects them from the miasmas. And the treatment include
boiling water or vinegar on wounds, magic potions, and prayers. These methods were not only ineffective but sometimes harmful. The mortality rate reached 16 to 19% in some cities. No. Today, the plague is curable if treated early. Antibiotics kill pestis, Yersinia pestis efficiently. Support care, fluids, oxygen, wound care, improve survival. Vaccines exist but are mainly high for high risk workers or research. Modern outbreaks like in Madagascar 2017 are quickly contained with medical and public health response.
Lesson learned. The Black Death taught humanity several crucial lessons. Public health matters. Sanitation, quarantine, and hygiene save lives. Science, superstition, understanding microorganisms revolutes the medicine. Globalization spreads disease, trade, and travel accelerate outbreaks relevant to modern pandemics.
Society transformed after pandemics, labor shortages empowered patent, changing economics and weakening feudalism. Fear mission can sprint faster than inflation, a timeline railer for today.